You hear it right there. Dr. Jennifer Avegno, the City of New Orleans Health Director, going one-on-one with WDSU. She looks back at this difficult year and how COVID-19 took a brutal toll on the city of New Orleans. It was also just announced that in the last 6 hours, indoor bar services must stop in the city of New Orleans. That'll happen just before midnight, right before New Year's Eve. WDSU's Aubrey Killian is live in New Orleans with the first part of our live team coverage. Aubrey.
Well, Dr. Avegno says those changes start at 11 o'clock tonight. She says they've got to follow the state guidelines. And she also says COVID cases here in New Orleans, they are going up at dangerous levels.
I'm pretty nervous.
Dr. Jennifer Avegno says after the city saw COVID tests coming back at more than 5% positive for 2 weeks in a row, per state guidelines, indoor service at bars, breweries, and adult live entertainment venues are banned. You can still get drinks to go or outside on a patio. Avegno also says that alcohol sales at indoor sporting events are not allowed.
I'd hoped we wouldn't get to this point. We were the only parish that could allow indoor bars for some time, and I think we were all really proud of that and the way we've handled it. But unfortunately, the surge that's been gripping the rest of the nation for some time now is here. And so, now is the time to double down even more as we head into a holiday weekend. We can't allow the numbers and the positivity rate to go up. Otherwise, we'll really be facing having to do even further restrictions.
And as Avegno looks back on 2020, she says it's safe to say that COVID-19 changed New Orleans.
We've seen doctors, nurses break down emotionally. Has that happened to you personally?
Yeah. I'd be lying if I said it hadn't. It's hard not to feel the toll on a professional, sort of medical professional level. I've watched people die in front of me from COVID, and it's heartbreaking. It's lonely. It's isolating. Our medical teams feel powerless, not having family there, having to communicate with family members over the phone. It's we see a lot of really challenging things, but this was new, and the fact that it continues to happen. It wasn't just something happening once. It happens over and over and over in our hospitals.
And while there's a lot of uncertainty going into the new year, Dr. Avegno says she's asking the people of New Orleans to keep pushing.
If we're sitting here 1 year from today, where would you want to see New Orleans, and what permanent changes could be here?
Yeah. I want us to have reached our level of immunization such that, what the experts are telling us is that we need at least 75 to 80% of a community to be vaccinated. I want us to be there. We are working around the clock to try and make that available for New Orleanians. I want New Orleanians to be first and to have this, available to them in multiple places. So I hope a year from now, we will not be holding on to these. We will be able to be closer to each other. We will be talking about our Mardi Gras plans for 2022. What I hope will change is maybe a real understanding of the importance of public health.
Now, Casey Ferrand is also live in New Orleans. She picks up our live team coverage. And Casey, what are bar owners saying about these big changes?